Hey everyone, welcome back. Today we're going to be taking a deep dive into something really important, especially for us Canadians.
Okay.
It's heart health.
All right.
And I was really surprised to learn that two-thirds of Canadians with ischemic heart
Oh,
disease
wow.
are over 65. That's where the heart doesn't get enough blood.
Yeah.
So this is something that's really important
That,
for us to be
dude,
talking about, especially as we get older.
for sure.
Our main source today is a guide from the National Initiative for Care of the Elderly in Canada.
Hmm?
It's called Heart Disease in Older Canadians, Prevention and Management.
Sounds like a great resource.
Yeah, it's fantastic. So let's dive in. First off, what exactly is heart disease? I feel like we hear that term all the time.
Right.
But
It can be kind of a broad term.
yeah, it is pretty broad.
Yeah.
So what are we really talking about here?
So heart disease is kind of like an umbrella term. It covers a whole bunch of different conditions that can affect the heart.
Got it.
But the one we see most often is coronary artery disease. You might also hear it called atherosclerosis.
Atherosclerosis.
Yeah. Basically what happens is the blood vessels that supply your heart with, all the good stuff.
Oxygen and all the nutrients and things.
Exactly. Those blood vessels start to develop this buildup of plaque. It's kind of like your pipes getting clogged.
Oh.
And when that happens, it restricts the blood flow. That can lead to some pretty serious complications.
So it's not just the buildup itself.
Right, there's more to it. See, inflammation actually plays a big role.
Inflammation.
It makes the plaque sticky, so it clings to the artery walls.
Oh, okay.
And that's why managing conditions like diabetes, which can really fuel inflammation, is super important for heart health.
It all kind of comes back around.
Exactly, it's all connected.
Okay, so how common is heart disease in Canada?
Well, the stats are pretty eye-opening.
Okay.
1 in 12 Canadian adults over 20 have already been diagnosed with some form of heart disease.
Wow. And what's the impact of that?
Unfortunately, it means that 14 Canadian adults with heart disease die every hour.
Every hour.
Every hour. And the death rate for people with heart failure is over 6 times higher
Wow.
than for those without it. So it's a serious issue.
Those are big numbers.
Yeah, that's definitely something to be aware of.
So is it the same for men and women?
That's a good question. Actually, there are some differences.
Okay.
Men are definitely more prone to heart attacks. They tend to be diagnosed younger.
Mm-hmm.
But here's the thing. As we age, the gap between men and women starts to narrow.
So age is a factor.
Age is a big factor.
What else should we be thinking about, especially as we, get older?
Well, our bodies change as we age, right? The heart and blood vessels can stiffen up a bit.
Okay.
And that's why high blood pressure becomes the most common risk factor after 75.
So we always hear about high blood pressure.
Right.
Are there any other, maybe lesser-known risk factors for older Canadians?
Something people might not realize is that sleep apnea
Sleep apnea.
can really increase your risk of heart disease.
Really?
Yeah, and it's more common as we get older.
Oh, okay.
Those pauses in breathing put a lot of stress on your cardiovascular system,
Interesting.
which can contribute to high blood pressure and other issues.
That's something I actually didn't know.
Yeah.
So besides age and sleep apnea, what are the other main risk factors we need to be aware of?
Well, you've got the usual suspects: high cholesterol, tobacco use,
Mm-hmm.
being sedentary, not getting enough exercise,
Right, right.
and a diet that's, lacking in the good stuff. Family history plays a role too.
It's always good to know your family history.
Definitely. And of course, conditions like type 2 diabetes and obesity also significantly increase the risk.
Right, because it all ties back into that inflammation.
Exactly. It all connects.
Or it sounds like there's a lot to consider. Is there any way to predict or diagnose heart disease before it becomes a serious problem?
Early detection is key. Your doctor can look at your individual risk factors and recommend screenings.
Screenings.
Things like checking your blood pressure, cholesterol levels, blood sugar.
So routine checkups are important.
Absolutely. There are also tests like electrocardiograms or ECGs, which measure your heart's electrical activity,
Okay.
and echocardiograms, which use sound waves to create images of your heart.
So those can provide more in-depth information.
Exactly. They can give your doctor a clearer picture of what's going on.
So what happens if someone is diagnosed with heart disease? What are the treatment options?
Well, it really depends on the type and severity of the heart disease.
Okay.
Often, the first step is lifestyle changes.
Like diet and exercise.
Exactly. Those are foundational. Then there are medications that can help manage things like high blood pressure and cholesterol.
Mm-hmm.
And in some cases, you might need procedures like angioplasty or bypass surgery.
So the treatment plan is really tailored to the individual.
Absolutely. Everyone's different, and their treatment plans should be tailored to their specific needs and circumstances.
That makes sense. I'm curious, are there any new developments or trends in heart disease that give us reason to be optimistic?
Actually, yes. Between 2000 and 2018, the number of new heart disease diagnoses in Canada actually went down.
That's great news.
Yeah, it is encouraging.
Why do you think that is?
I think a big part of it is just increased awareness.
Makes sense.
People are more informed about heart disease and what they can do to prevent it.
Right.
And public health initiatives promoting healthy lifestyles are playing a big role too.
So those efforts are paying off.
It seems so. And we can't forget about all the incredible advances in medical treatments for heart disease. New medications, procedures, and technologies are really making a difference in helping people with heart disease live longer, healthier lives.
So there's a lot of hope on the horizon.
Absolutely. We're making real progress.
Well, this is all really informative. I'm glad we're having this conversation.
Me too. It's important for people to be aware of this.
And speaking of being aware, in the next part of our deep dive, we're going to be talking about some of the preventative measures that people can take
Oh, great.
to protect their heart health. So stay tuned for that.
Looking forward to it.
Okay, so we're back and ready to get into some practical tips.
All right.
In part one, we talked about what heart disease is, how common it is in Canada, and all those risk factors.
Right.
But now let's talk about what people can actually do to protect their hearts.
Absolutely. Let's start with diet.
Okay.
Remember that clogged pipe analogy?
Mm-hmm.
Well, what you eat has a huge impact on those arteries.
So what should we be eating?
A diet full of fruits and vegetables, whole grains, and lean protein is a great foundation.
So that old advice to eat your veggies is still valid.
It definitely is. And don't forget about healthy fats. Things like avocados, nuts, olive oil.
Those are good for your heart, too.
Absolutely. They can help improve your cholesterol levels and reduce inflammation.
Okay. I'm always trying to be mindful of portion sizes.
Yeah.
Does that matter even if you're eating healthy foods?
It absolutely does. It's all about balance. Even the healthiest foods can contribute to weight gain if you overdo it.
That's true.
So try practicing mindful eating. Pay attention to your body's cues,
Yeah, listen to your body.
And stop when you're satisfied, not stuffed.
Good advice. Okay, so we talked about diet. What about exercise? How much do we need to stay heart healthy?
Well, you should aim for at least 150 minutes of moderate intensity aerobic activity each week,
Okay.
or 75 minutes of vigorous intensity activity.
So what kind of things are we talking about here?
Brisk walking is great. Swimming, cycling, dancing,
Okay.
anything that gets your heart rate up.
So find something you enjoy.
Exactly. And remember, you can spread it out over the week. It doesn't have to be all at once.
Yeah, it's about consistency.
Exactly. Consistency is key.
What about strength training? Is that important for heart health too?
Absolutely. Aim for moderate to vigorous intensity muscle strengthening activities that work all the major muscle groups, at least 2 days a week.
So we're talking things like lifting weights, using resistance bands.
Exactly.
Okay. How does that help your heart?
Well, building muscle mass actually helps boost your metabolism,
Okay.
and that can improve your overall cardiovascular health.
Gotcha. Okay, now let's talk about stress.
Oh yeah, stress is a big one.
It seems like everybody's stressed these days.
I know, right?
So how can we manage stress in a way that protects our hearts?
It's all about finding healthy outlets.
Okay.
Things like medication, yoga, deep breathing exercises, spending time in nature.
Those all sound really relaxing.
Right, and don't forget about social connections.
Oh, that's important.
Spending time with loved ones can do wonders for your mental and emotional well-being, which in turn, helps your heart.
Yeah, sometimes laughter really is the best medicine.
It's true.
Okay, let's go back to sleep for a minute.
All right.
We talked about sleep apnea earlier.
Right.
But just in general, how much sleep do we need for good heart health?
You should aim for 7 to 8 hours of quality sleep each night. And it's not just about quantity, but quality as well.
Okay. Any tips for getting better sleep?
Try to establish a regular sleep schedule, go to bed and wake up around the same time each day.
Yeah.
Create a relaxing bedtime routine. Make sure your bedroom is dark, quiet, and cool.
Okay.
And avoid caffeine and alcohol before bed.
That makes sense. What if someone's concerned about their heart health? What's the first thing they should do?
The most important step is to talk to your doctor.
Makes sense.
They can assess your individual risk factors
Yeah.
and recommend any necessary screenings or tests.
So don't wait. Go see your doctor.
Exactly. Early detection and intervention are key when it comes to heart health.
So we talked earlier about how new heart disease diagnoses are actually declining in Canada.
Yep.
What do you think is contributing to that positive trend?
I think increased awareness is a big factor.
Okay.
People are more educated about heart disease and how to prevent it.
Right.
And I think those public health initiatives promoting healthy lifestyles are really making a difference.
Yeah, it seems like those efforts are starting to pay off.
Absolutely.
It's encouraging to see that. And of course, we can't forget about all the advancements in medical treatments for heart disease.
Right.
New medications, procedures, technologies are helping people live longer, healthier lives.
It's a really exciting time to be in this field.
So even though heart disease is still a serious issue, there's a lot of hope for the future.
Definitely. We're making progress every day.
Well, in the next part of our deep dive, we're going to be exploring some of the great resources that are available to Canadians
Okay,
who want to learn more about heart health and find support.
great.
So stay tuned for that, and we are back for the final part of our deep dive on heart health in Canada.
Okay,
We've talked about what heart disease is and the risks and even those positive trends, but now let's focus on resources.
right.
What's out there for Canadians who want to take charge of their heart health?
Well, the good news is that there's a ton of great resources right here in Canada.
That's great to hear. Where should people start?
I think a good place to begin is the Heart and Stroke Foundation of Canada.
Okay.
They have so much info on heart disease, stroke, and healthy living.
It sounds pretty comprehensive.
Their website is like a one-stop shop.
Oh,
You can
nice.
find risk assessment tools, prevention tips, healthy recipes,
Wow.
even info on support groups.
Okay, so Heart and Stroke Foundation.
Hmm.
What if someone's a healthcare professional or they just want, more detailed medical info?
Then I'd recommend the Canadian Cardiovascular Society.
Okay.
They're a professional organization for cardiologists and other healthcare folks who specialize in cardiovascular care.
So lots of expertise there.
Their website's got evidence-based info on heart health, treatment options, all the latest research findings.
So it's useful for professionals and for everyday folks who want to do a deeper dive.
Exactly.
Okay, so we've got Heart and Stroke Foundation, Canadian Cardiovascular Society. Oh, and we can't forget about the Public Health Agency of Canada.
Of course.
They play a huge role in, public health.
Hmm.
They give us all that info and guidance on all kinds of health topics, including heart disease prevention.
It's a really valuable resource.
So their website has a whole section dedicated to heart health.
Yeah, it's really helpful.
Okay, so we've covered the national level. What about local resources?
A lot of smaller regional organizations provide really helpful services and support.
Like what?
For instance, lots of provinces and territories have cardiac rehab programs.
Cardiac rehab. Okay, what's that?
Well, these programs basically help people recover from heart attacks or heart surgery
Okay,
and improve their cardiovascular health overall.
that makes sense.
They usually include supervised exercise, education on heart-healthy living, even stress management counseling.
That sounds so helpful, especially for people who are recovering from a cardiac event and need some extra support.
Exactly. It could be a really tough time, so those programs can make a big difference.
What other local resources should people know about?
Don't forget about your local community centers, hospitals, and healthcare providers.
Oh, right,
They
yeah.
can often connect you with local support groups, workshops, stuff like that.
So many resources.
It's really encouraging.
It sounds like Canadians have a lot of support available if they want to prioritize their heart health.
Definitely.
This has been a really eye-opening deep dive into this super important topic.
I agree. It's been great to talk about this.
We've learned about the impact of heart disease, how to prevent it,
Hmm.
those encouraging positive trends, and all those great resources out there.
It's a lot to take in.
Before we wrap up, I want to leave everyone with something to think about.
Okay.
We've learned so much about heart disease in Canada, so what's one tiny step you can take today to improve your heart health or the heart health of someone you love?
That's a great question.
It could be something super simple, like swapping out a sugary drink for water,
Oh, yeah.
taking a quick walk, or even just calling a friend for support.
Those little things really can add up.
Absolutely. Every little bit counts, and you don't have to go it alone.
That's so important to remember.
There are resources out there and people who want to help you live a longer and healthier life.
Absolutely.
Thank you for joining us for this deep dive into heart health.
Thanks for having me.
We hope you feel empowered to prioritize your heart health and that you know that you're not alone in this journey.
It's been great.
Until next time, stay curious, stay informed, and stay heart healthy.